Now today the topic that we are going to discuss is about the mediastinum. Okay, so this is one of the important topics जो होता है that is related to the anatomy of the thoracic cavity. So what is a mediastinum? So the mediastinum is basically a median septum of the thoracic cavity which lies between the two pleural cavities. Now as you know, there are two lungs, that is the right and the left lung in the thoracic cavity, which are covered by a coating which is called as the pleura. And so the mediastinum is basically a median septum of the thoracic cavity and it lies between the two pleural cavity. Okay, now it is a broad central partition which is separating two laterally placed pleural cavities. So it is acting as a separation, that is separating the two pleural cavities which are present on the either side. Now as you might have studied, the pleura, that is the visceral and the parietal pleura are there. The visceral pleura is firmly attached to the lungs, whereas the parietal pleura is divided into four parts, that is the costal pleura, mediastinal pleura here, okay, then cervical pleura and the diaphragmatic pleura here. Okay, so this mediastinum जो होता है is basically covered by the mediastinal part of the parietal pleura. Now in this diagram, which is a scheme of the thoracic cavity, it is for your understanding how the mediastinum is described here. Okay, so if I say, let me outline it, this you can see on either side there is the left lung and there is a right lung, and the space which is present between these, the right and the left lung, this middle part here is called as the mediastinum here. Okay, now first we have to learn about what are the boundaries of the mediastinum, that is what are the structures present around the mediastinal part. So first, anteriorly there is a bone, that is the sternum, which is an example of a flat bone. Posteriorly lies the vertebral column here. Superiorly lies the superior thoracic aperture. Inferiorly lies a very important muscular organ, that is the diaphragm, and on each side lies the mediastinal pleura here. So the boundaries of the mediastinum, or the parts which are surrounding, or the structure which are surrounding and forming the borders of the mediastinum, they include the anterior boundary formed by the sternum, the vertebral column forms the posterior aspect, the superior thoracic aperture forms the superior aspect, and the inferior aspect is formed by the diaphragm, and on each side जो होता है, it is formed by the reflection of the parietal pleura onto the mediastinum, which is called as the mediastinal pleura here. Okay, now in this structure, this is a very good diagram which helps us to understand what are the boundaries of the mediastinum. Here you can see the mediastinum divisions are given in the diagram too. Okay, just before starting with the detail, you should know there is a superior mediastinum and there is an inferior mediastinum. Okay, now inferior mediastinum is again parted into three parts, that is the anterior mediastinum, middle mediastinum and the posterior mediastinum. These are the divisions of the mediastinum. Now again, first we have done the boundaries. So again you can see anteriorly the whole of the mediastinum, we are considering both the superior as well as the inferior. Okay, so anteriorly you can see there is a flat bone, that is sternum. So anteriorly the mediastinum is bound by the sternum here. Posteriorly it is bounded by the vertebral column, as you can see this is a vertebral column. Inferiorly it is bounded by the diaphragm here. Okay, and on either side it is bounded by the mediastinal pleura, and superiorly it is bounded by the superior or the upper thoracic inlet. Okay, this is the thoracic inlet here. Okay, so these are the boundaries of the mediastinum. So first we will do boundaries. First you have to write about the boundaries, then you have to write what are the structures which are present within the mediastinum. Look, we have to study individually what structures are present in the superior mediastinum and as well as the structures which are present in the inferior mediastinum here. Okay, so the major contents of the mediastinum, that is the general contents we are doing, are first is the thymus gland, then the heart, which is enclosed in the pericardial sac. There are major arteries and the veins such as the thoracic aorta, pulmonary trunk, etc. Very important two structures related to the GIT as well as the respiratory, that includes the trachea and the esophagus. Then comes the thoracic duct. Then certain neural structures such as the sympathetic trunk, vagus nerve, phrenic nerve, etc. And also the eighth content is the lymph nodes. Okay, so this is the general contents as such which are present in the whole of the mediastinum, which includes the superior mediastinum as well as the inferior mediastinum. Now coming to the divisions of the mediastinum. The diagram that I have shown you earlier itself, that includes two parts of the mediastinum, that is the superior mediastinum as well as the inferior mediastinum. Okay, so the mediastinum that is present inferiorly is further divided into three types of mediastinum, that is an anterior mediastinum, a posterior mediastinum, and a middle mediastinum here. Okay, now this is a flow chart that is showing the division. So this is a mediastinum, which is basically a median cavity present in the median part of the thoracic cavity, which separates the two pleural cavities, is further divided into two parts, that is the superior mediastinum and the inferior mediastinum. The inferior mediastinum is further divided into the anterior, middle, and the posterior mediastinum here. Now this is the division here in this diagram. It is easily visible. This part, the pinkish part that you see here, this is the superior mediastinum here. The part below the superior mediastinum, that is along below the sternal plane, is called as the inferior mediastinum. Here the inferior mediastinum is further divided into an anterior mediastinum, a middle mediastinum, as well as a posterior mediastinum. This is a colorful representation which helps to distinguish between the three parts or the divisions of the mediastinum. This green color is the superior mediastinum here. This purple color is basically the anterior mediastinum, which is again a part of the inferior mediastinum. This yellow color is the middle mediastinum, and this larger blue color part is the posterior mediastinum here. So it is one of the partitions or divisions of the mediastinum. Now today we will take each and every mediastinum altogether here. The mediastinum that we are going to take is the superior mediastinum. Now whenever you are studying mediastinum, please remember you should know the boundaries of the mediastinum. Since it is a median part which is present between the two pleural cavities, it is bounded by certain structures. Okay, so whenever you are studying whether it is inferior mediastinum or whether it is superior mediastinum, you should know what are the boundaries of that particular mediastinum. Okay, so the superior mediastinal boundary include anteriorly every mediastinum includes the sternum here, so that is the manubrium sterni. Okay, then posteriorly it includes the bodies of the upper four thoracic vertebra, that is T1 to T4 जो होता है vertebra, are forming the boundaries of the superior mediastinum. Now superiorly is the plane of the superior thoracic aperture, and inferiorly there is an imaginary line which is passing through the sternal angle in front and the lower body of the fourth thoracic vertebra, and on each side it is bounded by the mediastinal pleura here. Okay, now coming to the what are the contents which are present in the superior mediastinum. So first are the arteries, which are very important. These includes the arch of the aorta and its three branches, that is the brachiocephalic artery, left common carotid artery, and the left subclavian artery here. Then includes the veins, that is the right and the left brachiocephalic veins, upper half of the superior vena cava, and the left superior intercostal veins here. Then comes the nerves which are present in the superior mediastinum. These include the phrenic nerve, that is the right and the left, then the right and the left vagus nerve, then right and left sympathetic trunk and the cardiac nerves, and the left recurrent laryngeal nerves. Okay, then comes the lymphoid organs and the lymphatics which are present in the superior mediastinum include lymph nodes, thoracic duct, and the thymus. The two tubes which are present in the superior mediastinum are the trachea and the esophagus, and the muscles which are present are sternohyoid, sternothyroid, and the longus colli muscle. So if a question comes on what are the contents or enumerate the contents of the superior mediastinum, you have to write in the same order. First you have to write about the arteries which are present, then the veins which are present, then the nerves, lymphatic organs, tubes, and the muscles which are present within the superior mediastinum. Occasionally a diagram can be asked regarding the contents of the superior mediastinum. Here you can see the arch of aorta, the right brachiocephalic vein, the left brachiocephalic vein here, and the branches of the aorta. You can see brachiocephalic artery, left common carotid artery, and the left subclavian artery. Two tubes that you can see is the esophagus and the trachea. Then you can see the left recurrent laryngeal nerve here. So important nerves here, there is the right and the left vagus nerve, are also the contents of the superior mediastinum. So it is a good diagram that explains what are the contents of the superior mediastinum. Now this is a transverse section of the superior mediastinum, in which it is showing the arrangement of all the contents of the superior mediastinum. So these two diagrams are very important, and please go through it, because if the diagram can be asked as a question, otherwise the contents can itself be asked as an enumerate question. Okay, now coming to the anterior mediastinum. Now the anterior mediastinum is a part of the inferior mediastinum. I have told you basically we divide the mediastinum into a superior mediastinum and an inferior mediastinum, but when we consider inferior mediastinum, it is further divided into three parts, that is an anterior mediastinum, a posterior mediastinum, and a middle mediastinum. So first one is the smaller one, that is the anterior mediastinum, a part of the inferior mediastinum. It is bounded anteriorly by the body of the sternum. Posteriorly it has a heart enclosing the enclosed by the pericardium. Then superiorly is the transverse thoracic plane, which is separating the superior and the inferior mediastinum here. Inferiorly diaphragm, and on the each side the mediastinal pleura. Now please remember, inferiorly and on each side the structures are the same. Inferiorly of the inferior mediastinum, which includes all the three, that is anterior, middle, and posterior, are bounded by diaphragm, and on each side they are bounded by the mediastinal pleura here. Now in this you can see the structure here. This is the superior mediastinum, and this is the inferior mediastinum, and this is the transverse plane which is going through the sternal angle, which divides the mediastinum into a superior and the inferior. Again, then inferior is again divided into an anterior one, which lies anterior aspect. There is a middle mediastinum in which the heart is lying, and there is a posterior mediastinum. Now, what are the contents of the anterior mediastinum? Now, the contents include loose areolar tissue, superior and inferior sternopericardial ligaments stretching between sternum and the pericardium. Then there are 3 or 4 lymph nodes. Then there are mediastinal branches of internal thoracic artery and the lower portion of the thymus, which is present only in the children. As we grow or when we become adults, the thymus जो होता है that shrinks inside and does not have any function here. Okay. Now coming to the middle mediastinum. Anteriorly it is bounded by the anterior mediastinum, posteriorly it is bounded by the posterior mediastinum, and superiorly it is bounded by the superior mediastinum. And inferiorly, I have told you, all the inferior mediastinal parts are bounded inferiorly by the diaphragm here. Now the contents जो होते हैं, please remember it is very important. Why? Because the heart is the main content of the middle mediastinum. Okay, so the contents include a heart, the covering of the heart, that is called as the pericardium. Then includes the arteries, important arteries, which includes ascending aorta, the pulmonary trunk dividing into pulmonary arteries, pericardiophrenik arteries here. Okay. Now coming to the contents here, the veins includes the veins which are present in the middle mediastinum are the superior vena cava, the lower half, azaica is vein, that is the terminal part, pulmonary vein, that is the right and the left pulmonary vein. Nerves included in the middle mediastinum include phrenic nerves, deep cardiac plexus. Then comes the lymph nodes, that is tracheo-brachial lymph nodes are present in the middle mediastinum. The two tubes which are present are the bifurcation of the trachea and the right and the left principal bronchi here. Okay, so these are the contents of the middle mediastinum, that is the heart along with its pericardium and other structures which are related to the heart itself. Okay. Now this is again one more diagram which is showing the division of the superior and inferior mediastinum. Inferior again divided into the anterior, middle and the posterior here. Now coming to the posterior mediastinum, okay, boundaries include anteriorly the pericardium and its content, that is the heart. Then there is bifurcation of the trachea, pulmonary vessels. Posteriorly the bodies of the lower 8 thoracic vertebra and their intervening intervertebral discs. Superiorly it is bounded by a transverse thoracic plane which separates superior mediastinum from the inferior mediastinum. Again inferiorly it is bounded by the muscular organ, that is the diaphragm, and on each side by the mediastinal pleura. Again the posterior mediastinum includes esophagus, thoracic duct, descending thoracic aorta and its branches, azygous, hemiazygous and accessory hemiazygous vein, vagus nerve, sympathetic trunks and splanchnic nerves. Okay, then it also includes posterior mediastinal lymph nodes. Okay, these are the contents of the posterior mediastinum here. Okay. Now please remember, it is very important, you should know what are the contents and the boundaries of each of the mediastinum. It can be asked as an enumerate question. Sometimes a diagram may be also asked showing the contents and the boundaries of the particular mediastinum. So next, that the thing that we are going to do is a clinical correlation. Now please remember, whenever you are dealing with any topic in anatomy, it should be ending with the clinical aspect or the applied aspect of that particular part. Then only it is much more clear why it is important to study a particular part, because we should know what diseases are affecting that particular part and what may be the clinical features of that particular disease. So first is mediastinitis. Now wherever the term is coming itis, that represents the terminology that is inflammation. So mediastinitis basically means inflammation of the loose connective tissue of the mediastinum here. Okay. Now the facial spaces of the neck, that is the pretracheal and the retropharyngeal spaces, they extend below into the mediastinum inside the thoracic cavity. Now whenever there is infection of the neck, may readily spread into the mediastinum inside the thoracic cavity, and the deep infections of the neck may readily spread into the thoracic cavity, causing mediastinitis. So whatever there is infection in the neck can be transmitted into the mediastinum, as the superior thoracic aperture is present on the superior aspect of the superior mediastinum. So whatever infection is present in the neck can spread to the mediastinum and results in the inflammation of the mediastinum, and this condition is called as mediastinitis. Okay. Then there is subcutaneous emphysema in the root of the neck. Now what happens, the structures that make up the mediastinum, they are embedded in a loose connective tissue that is continuous with the loose connective tissue of the root of the neck. For that region, any esophageal perforation which can be caused due to some penetrating wound, air may enter into the connective spaces of the mediastinum and could ascend below the fascia to the root of the neck, producing a subcutaneous emphysema. So as such, any infection or any injury which is resulting in the neck area can spread or may cause irritation in the mediastinum. That is much more important part that you have to remember. Now the second clinical condition is called as the mediastinal syndrome. Okay. Now the compression of the mediastinal structures by any growth like a tumor or a cyst gives rise to a group of signs and symptoms. The common causes of mediastinal syndrome are the most common cancer of the lung, that is a bronchogenic carcinoma. There can be aneurysm of the aorta, which is very common. Then there is enlargement of the mediastinal lymph nodes in a disease which is called as Hodgkin's disease, which will result in a series of symptoms which will assembled as mediastinal syndrome here. Now, what are the clinical features of the mediastinal syndrome? So first is engorgement of the veins in the upper half of the body because of obstruction of the superior vena cava. There will be dyspnea. Dyspnea is difficulty in breathing because of the compression of the trachea. There will be dysphagia, that is difficulty in swallowing because of compression of the esophagus. There will be pressure on the left laryngeal recurrent laryngeal nerve, which will result in hoarseness of the voice. There will be pressure on the phrenic nerve, which causes paralysis of the diaphragm, as the main nerve supply of the diaphragm is by the phrenic nerve. Pressure on the intercostal nerves gives rise to pain in the area which is supplied by them, that is called as intercostal neuralgia. Then the pressure on the vertebral column may result in the erosion of the vertebral body. So these are a group of symptoms which are caused due to the suppression or due to the advancement of pressure in the mediastinal parts due to certain growth or certain diseases, and these symptoms are combined into a part and they are termed as mediastinal syndrome here. Okay, now the next is the mediastinal shift. Now the mediastinal shift, it is very common in the lung and the pleural pathologies or diseases which are related to the lung and the pleura. Now the mediastinal shift to the affected side, that is the disease site, because of the appreciable amount of reduction in the lung volume and the decrease in the intrapleural pressure, as in cases of collapse of the lung. Now the mediastinal shift जो होता है to the healthy side when the intrapleural pressure is appreciably high on the affected side, as in cases of hydrothorax and pneumothorax. Pneumothorax is presence of air in the pleural cavity here, and hydrothorax is presence of water in the lungs here. Now, the mediastinal shift indicates always a lung pathology. The mediastinal shift can be discovered by palpating the trachea in the suprasternal notch here. Okay, that is how we can diagnose or we can see if there is mediastinal shift or not. Then the next clinical anatomy or the clinical part includes the widening of the mediastinum. Now, the widening of the mediastinum is frequently observed in the chest radiograph. It can occur because of a number of reasons, like hemorrhages into the mediastinum from the lacerated great vessels, that is the superior vena cava and the aorta, following any trauma, example head-on collision. So first, collection of blood in the mediastinum will result in the widening of the mediastinum. Then massive enlargement of the mediastinal lymph nodes because of cancer may also result in widening of the mediastinum. Then enlargement of the heart because of some congestive heart failure, that is called as hypertrophy of the heart, will also result in the widening of the mediastinal cavity. Then coming to the extension of pus into the posterior mediastinum from the neck. Now the posterior mediastinum is continuous to the superior mediastinum with a space in the neck between the pretracheal and the prevertebral layers of the deep fascia, like the retropharyngeal space. For that reason, pus from the neck can extend into the posterior mediastinum. I have already told you in the later when we have done mediastinitis, what happens, there is a connection between the root of the neck as well as to the mediastinum here. So whatever infection is present in the root of the neck can be spread into the mediastinum through the upper inlet जो होता है of the thoracic, superior thoracic inlet or aperture, and may the infection may spread into the mediastinal cavity here. Okay, so this is about the general introduction, that is what is mediastinum. It is a median cavity present between the pleural cavities. Here it is separable or divided into two parts, a superior mediastinum and an inferior mediastinum. A superior mediastinum is present on the upper part, which is divided जो होता है by into an inferior part by a transverse plane passing through the sternal angle. The inferior mediastinum is further divided into three parts: anterior, middle and the posterior. You should know what are the boundaries of the posterior inferior mediastinum as well as the main contents of the mediastinum, and you should also know the clinical anatomy or applied anatomy of the mediastinum. Then only the question will be complete, and it is a very important part of the thorax that you have to study, because clinical practice you should know what are the structures which are related in the mediastinum, so it is easy for you to come to the diagnosis of what diseases may cause various infections or shifts in the mediastinum here. Okay, thank you so much for your time, and please go through the notes here. Thank you.